In 2001, at the Africa Summit at Abuja, Nigeria's Federal Capital Territory, the member states of the African Union pledged to allocate at least 15% of their government budget towards the health sector. Over 15 years down the line, what happens to the Abuja Declaration? With 257.3 billion naira allocated to Nigeria's health sector out of over 6.06 trillion naira, which is just about 5% of Nigeria's total budget in this 2016 budget. This becomes more worrisome with the outcry of infrastructural deficit in Nigeria's health institutions. What's more, Nigerians are still at loss with the report of the president's medical trip abroad for an ear infection treatment in June this year. Then what happens to the fate of an ordinary Nigerian who may not be able to afford the luxury of traveling abroad for medical trip? It's question time. Welcome to the program. I'm Benga Ashiru. You may also send us a comment on our various social media platforms showing on your screen. The health sector in Nigeria is one of the most unionized sectors in the country, with the resident doctors many a times down in tools over what it describes as failure of the federal government to honor the agreement signed between them. As Nigeria's health sector desperately cries out for an intervention, what's the rescue plan for Nigeria's health sector? Channel's TV crew had a chat with the Minister of State for Health, Dr. Osagie Ehanire. Join us in this exclusive interview.
The National Policy on Health creates a framework for health service delivery to Nigerians by building upon the National Health Strategic Plan to help to create the foundation by which healthcare service will be delivered to the public. It's a guideline for the states, for the ministry, also for the hospitals to be able to follow a set down pattern.
How would you assess the effectiveness of this national health policy, bearing in mind the resurgence of some diseases in the country, like the Lassa fever and polio, bearing in mind that, recall that we are now losing the 2017 certification?
Well, one of the points in the service in national health policy is that the states are encouraged to dedicate 50% of their budget, according to Abuja Declaration, to the health sector, and also improved guidelines for addressing emerging diseases and disease outbreaks. Improved from what we had before. The policy has been updated, as you know, and the responses are building in lessons learned from the past so that we can address these disease outbreaks more efficiently. The polio outbreak, as you said, is already being forcefully addressed, and the recent Lassa fever outbreak is also being very clearly and properly followed and addressed. We are not caught by surprise as we were last year.
How feasible is the Abuja Declaration that 15% of the state's budget should be committed to the health sector?
15% is what the Abuja Declaration prescribed. It is not mandatory, and we are trying to encourage all states to try to do that, and if possible to go as near to 15% as possible. The investment in health, particularly in preventive health and promotive health, is extremely beneficial in that it saves you a lot more expenses on treatment. It saves you more investment in complicated medicines and procedures. So this investment of 15%, although it's difficult in the face of competing needs, is something we would like the states to strive towards, the federal government also to strive towards increasing our budgetary allocation for the health sector to that number. A healthy nation, as you know, is a wealthy nation.
In terms of meeting up with the competing needs in the health sector, would you say there is a political will in terms of compliance to this 15% pledged during the Abuja Declaration to address the health sector?
I believe that the political will is there, and I believe that there are some states where the obvious challenges of health are visible and where they are considerate of the need to put more money into the health sector. There will be one or two other states who feel that their priorities are different, who may not put as much. That's the reason why we appeal to them to remember and also encourage them to know that investment in health is not money wasted, because it is money that will save you a lot of lost man hours. It's money that will save you further expenses down the road in curative medicine. If you prevent, as they say, it is better than cure. So, but you have to put something into prevention in order to be able to save on the cure.
Many experts, medical experts, have said that the focus of this administration should be on cancer treatment, infant and maternal health facility, and also the need to build infrastructure research. How far would you say you've fared in these areas?
The administration has fared very well, I would say. The government of President Muhammadu Buhari has put great emphasis on healthcare delivery. That is one of his promises during his campaign, and it is being followed up. We are reviving the program which Ransom Kuti had started before, which was not able to be sustained, of bringing healthcare, primary healthcare, closer to the people, and trying to renovate up to 10,000 primary healthcare centers. We are doing these in phases because we can't do all at once. But over the next 4 years or 5 years, we are going to have these healthcare centers working to be able to provide a basic minimal healthcare package to Nigerian citizens, so that no Nigerian will need to travel far away to seek healthcare. They do not need to go to teaching hospitals to overcrowd the outpatients departments. A majority of cases that need to be taken care of for which people go to the hospital are simple things like fever and little cuts and bruises and waist pain and so on, which can be taken care of very easily at primary healthcare centers by trained staff. So they save not only in money, they also save in transport costs.
We understand that the Federal Capital Territory and other 36 states are to share $1.5 million earmarked for the primary health care. How far has this administration gone in this regard?
It was just a month ago that this disbursement was made, and not all states have got their disbursement yet, because they have to meet certain conditions for receiving the money, financial conditions of opening dedicated accounts. But the purpose of that money is to meet 6 health pillars of primary health care to improve the health outcomes in the country. As you know, the program runs under the head of what is called the Save 1 Million Lives, which started to address an issue that has been an embarrassment to the country. The issue is that 900,000 to 1 million Nigerian women and children die annually. Now, the peculiarity of this program is that you are not giving money to carry out the program. You are giving money to start, but after that, you are going to be receiving disbursements based on particular links that you are going to targets, or you are going to have achieved. Then you can receive more money if you have achieved the targets that are set for you.
You are managing a highly unionized sector. What would you say is responsible for the myriads of conflicts in the health sector? Who is responsible for these conflicts?
Well, there are many issues that are at stake there. A lot of them are avoidable, and in my view, a lot of them need not be at all. And the government in place now is trying to understand the origin of many of these conflicts. Nearly all of them predate the advent of this regime. Some of them are said to be court cases, and others are said to be agreements that were not honored. But whatever agreement that this regime of President Muhammadu Buhari has set up has been honored. Many of the agreements from the past are things we are still trying to study. We do not understand how they came about. We do not understand the essence of a lot of it. But as we study them and get the hang of these agreements, we begin to see how to resolve them. Where there are issues, we are conversing We have a conversation going on with the unions all the time. Even now, as I talk to you, there's ongoing conversation to try and resolve issues, to try and understand the various positions.
What are the contentious issues in disagreements?
Contentious go around authority within the hospital, they go around salaries, they go around seniority, and a lot of them are not, they are not issues that need to be at all. And some of them are issues where the court had to pronounce, where we don't believe that really there are things where court even needs to pronounce, because the relationship between doctors and patients and hospitals is set down by tradition. All over the world, there's a clear relationship. It is surprising that in Nigeria, the court has to be determining certain relationships, like relationship between the doctors and laboratory assistants or attendants or technicians. These are things that are laid down by tradition, by convention, by relationships all over the world, in all countries. There's no friction in that regard. Here, it looks as if we are just trying to recreate things. We are not the ones who recreated medical service. But we are trying to build a relationship that already is laid down by convention.
Now let's come to the issue of seniority between the resident doctor and the attendant staff. What is the true tradition? What is the actual tradition?
Traditionally, the relationship in a hospital is between a patient who comes there seeking help and a doctor who he seeks help from. It is doctor who attends to the patient, who is the patient's primary partner, and who is the main reason that anybody goes to a hospital. And it is from the doctor that all other services are brought in. Laboratory service, x-ray service, and nursing service, all through the relationship the doctor establishes with a patient. Simple, that's the way it is. Now, there are seniorities among the doctors, seniority among nurses, seniority among laboratory technicians, and so on and so forth, and health record officers. But in the various groups, we do not talk so much of seniority, we talk of responsibility. Everybody plays their own role. You know your responsibilities, you know your duty. But generally, the hospital is a place where the doctor sees the patient, where the patient goes to look for the doctor, and the doctor is the one who attends to them. Others are all services that support what the doctor is supposed to be doing for the patient. Nobody goes into hospital primarily to go and see the laboratory technician. He has to be referred by the doctor. So everything is supposed to work in one group, in one order. And it is the breakdown of this relationship that is the cause of a lot of the problems we are facing now.
The residence doctor have been the most vehement in terms of its demands in the health sector. How do you see the demands of the residence doctor? Do you think it is justified?
The demands of resident doctors are many. Much of it is around money, around salary, around perks and privileges, around allowances, and they are so complicated that it's difficult to understand what these problems are and how they came about in the first place. But they all predate this regime, and we are in the process of trying to study this complicated scenario. We have had to bring in other areas that have to do with salary, with income and wages commission. We have had to bring in budget ministry. We have had to bring in a labor. So we are having a conversation that is to try and iron out all these difficulties regarding salary and allowances, and who is supposed to collect allowances and who is not supposed to, who is supposed to step in at a particular grade level, because they have the grade level issues. And some of their demands are justified, I would say. Others are not justified. But whatever the situation, I do not believe that doctors should be going on strike, because it is a serious issue to withdraw services. It puts the life of patients in danger. It puts the life of Nigerians in danger. There is no problem that cannot be sorted out by dialogue, by conversation. It might take a short time, it might take a long time, but they will be sorted out.
You may also join in this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, find out the Minister of State for Health's comment on medical tourism in Nigeria.